My name is Megan Riley. I'm a speech-language pathologist working at Functional Speech Therapy in Fox River Grove in Illinois. In this video, I'll be talking about AAC and discussing some common misconceptions. To start, AAC stands for Augmentative and Alternative Communication. Augmentative meaning in addition to speech, and alternative meaning instead of any verbal communication. AAC ranges from gestures to sign language to paper communication boards, all the way up to high-tech AAC devices. These various systems allow people to communicate without using speech. Now, there are a lot of misconceptions surrounding the use of AAC, so I want to talk about 5 of them today. Myth 1. If my child uses AAC, it will prevent them from talking, or it means we're giving up on verbal speech. The truth is, AAC does not prevent the development of verbal speech. In fact, for many kids, it helps foster that speech development. Especially with devices with voice output like this one, the child receives frequent models of the words for them to imitate. Help. Using verbal speech, if it's an option, will be easier and faster, and kids want the quickest way to get what they need. Myth 2. AAC is a last resort. The truth is, early implementation of AAC can reduce frustration for the whole family while the child is developing their speech. Having access to basic communication boards like this one promotes independence and calmer communication between non-speaking children and their adults. Myth 3. My child needs foundational skills to use AAC. The truth? There are no prerequisites to using AAC. Any child with any level of skill can begin to use AAC. The best part about having so many options for AAC is that the device is tailored to the child's needs and abilities. This goes for hearing, vision, motor, cognition, and language capabilities. Implementation meets the child where they are. Plus, oftentimes, children have skills that we don't even get to see until after we start using AAC. Myth 4. My child has some speech, so they don't need AAC. The truth? This actually goes back to the definition of AAC. For most users, AAC devices are augmentative, or in addition to their verbal speech. The goal of AAC is so that every child can say what they want, when they want, and be understood. If verbal speech is not enough for a child to meet all of their communication needs, AAC should be considered. Myth 5. Once they start using AAC, my child is stuck using it for the rest of their life. The truth? If a child's verbal speech develops to the point where they can meet all of their needs using speech alone, then there's no reason for that child to continue to use their device. Now that you know a little bit more about AAC, if you're looking for any more information, reach out to a speech-language pathologist, like me.